Hello, this is the Global Health course that is being offered through Virtual Sabana at Universidad de la Sabana. And I'm Gail Fraser, and this is week 1. Global Health, as you can see from this map, involves countries all over the world. And I'm a public health professional. I've worked in a lot of different countries over the years. My career has spanned almost 40 years, and I have lived and worked in 18 different countries, including countries in Latin America, including Colombia, Asia, including Indonesia, North America, including parts of the United States, and the Middle East most recently for the last 8 years. Let me tell you a little bit about my career so that you'll have a good introduction to why I was selected by Unisabana to present Global Health course, because I have started my career in Trinidad and Tobago. So you can see it's a tiny little country. You probably see Cuba, big old Cuba, and Jamaica, Haiti. Okay, but down here just off the coast of Venezuela is Trinidad and Tobago. I was working at the Pan American Health Organization and actually working in the Medical Research Council laboratories at the Caribbean Epidemiology Center, which used to be based in Port of Spain, Trinidad. The projects I worked on were related to rabies, leptospirosis, and hepatitis. So they're all very dangerous diseases and must be handled in high security laboratories. So I traveled throughout the region. So I went up to Barbados and Grenada, Suriname, Belize, the different CARICOM nations to train laboratorians how to safely handle these very dangerous infectious agents. I worked in the United States. One of the positions I had for 5 years was working in Houston, Texas with Baylor College of Medicine, and one of the projects I worked on was related to cardiovascular health. It was actually a lead program from University of Washington in Seattle, Washington, and it's one of the reasons why we've changed the CPR method. We used to do ABC, airway, breathing, compressions. Now we do CAB, which is compressions, airway, breathing, and that was based on the research that was gathered by this program. I also worked with the Center for Women with Disabilities, and we had an NIH grant, and we were looking for ways to encourage people that had physical disabilities, spinal cord injuries mainly, who were using wheelchairs to overcome those disabilities and still become more engaged in their communities. I've worked in Southeast Asia, so I enjoyed living in Indonesia for 6 years. And one of the projects that I worked on when I was living in Indonesia was with Johns Hopkins University. And it was the prevention of postpartum hemorrhage among women who have their babies at home. So pregnant women who give birth at home without a midwife or a skilled nurse or no access to a health clinic, very often, unfortunately, they start bleeding after the baby is born. And in these kinds of obstetric emergencies, these women were dying. And this project, we initiated a different method. We educated the women, and they were able to better cope with the emergencies, and we reduced the rate of deaths by postpartum hemorrhage by 50%. It was really a rewarding project to work on. While I was living in Indonesia, I also worked in West Papua, because you have to remember that Indonesia is a very big archipelago of 13,000 islands. So Java, this is Sumatra, this is Java, this would be Kalimantan. Way over here is Papua. Half of it is Papua New Guinea, which is a separate country. West Papua is the side that we were working on that's part of Indonesia. I was working with the U.S. Navy as a civilian research scientist, and my responsibility was primarily monitoring the information systems the databases that gathered information about the recurrence of malaria among individuals who lived in Papua. We were given money to do a clinical drug trial of the medication that's pretty standard now. In early 2000, we were looking at Malarone and making sure that it was preventing malaria. I've worked in Africa a total of 8 years, so choose your place: West Africa, East Africa, Central Africa, Southern Africa, North Africa. I've worked in all of those locations. Here I am with my colleague from Mozambique, Carla, and we were in the process in several different regions in East Africa, so Tanzania, Mozambique, and even Southern Africa. We were implementing health information systems to improve the accountability and the drugs that were being given to people with HIV/AIDS. And so this was a project that had funding through Columbia University, which is in New York City, New York, and their offices and big hospitals that they're linked to are in Manhattan. But they had 14 international sites, and I worked in Dar es Salaam, which was in Tanzania, for 2 years. I also have worked in Thailand and throughout Southeast Asia. When I was with the American Red Cross, I was fortunate to be based in Bangkok. It's the only time that the American Red Cross has had an international office. There were just 6 of us and our team leader. We were traveling throughout the region because the American Red Cross donated $60 million to the recovery for the 5 countries we worked in. So I traveled to India, Sri Lanka, Maldives, the northern part of Indonesia, which is Aceh, and southern Thailand. And we were making sure that they were measuring the positive change on disaster preparedness, health interventions and water and sanitation. For the past 8 years, I have also worked in the Middle East. So one of the countries that I've worked in is Qatar. So you see big old Saudi Arabia here, and of course here's Iran and Iraq to the north. And here is Oman, here at the boot of Saudi Arabia, right next to Yemen. So we're getting a bit of the geography because the countries that I've worked in are really small. So here is Qatar. This is a little pink on this map peninsula. I worked there for 6 years, and now for the last 2 years I've been working in United Arab Emirates. So this is where Dubai is, located directly across the Arab Gulf here, near Iran and on the Saudi Arabian peninsula. Here I am with my colleagues from Qatar. You can see the men wear the traditional white robe or thobe and the white headdress. And my Layla, my colleague from Qatar, she is wearing the traditional black abaya. And you can see I'm wearing very modest clothes, a long skirt. And I am on my left is my boss. He was the CEO at that time for the National Health Authority. He was Australian, so you see he didn't have the traditional dress. One of the places that I worked in Latin America was Guyana, and we were doing work with the Guyana HIV/AIDS reduction program. Here's my colleague Michael, and we were working together to set up field trials for evaluating how medical staff and clinics and the nurses and treat people with HIV when they come in for treatment, because it can be a very negative experience for people going in for help if they are treated poorly because they have HIV. Any sexually transmitted disease, people have a lot, there's stigma, and so we were trying to improve the healthcare access as well as the healthcare providers' attitudes toward people with HIV. Of course, I worked in Colombia, and I was a teacher there until recently when my family moved back to the Middle East, and I was able to work with the Faculty of Medicine on a community health intervention, with the School of Nursing, I taught some occupational health and safety classes, as well as the global health. And then every year I come back sometime in the summer and give a disaster preparedness workshop. So I'm hoping to come again in July in 2015. Here I am. Next steps is in the United Arab Emirates. So you could see UAE right here on the tip of the Saudi Arabian boot. And of course you recognize the Burj. Here we are paddling around. The main purpose of the course here is hoping that you will be willing to join. Basically it's like a global health adventure. I'm seeing that the students will be like photojournalists, and this is the end of this clip. I'd like to share with you a video which will be part of this video, and if it cuts off before it is complete, then the video is called Power of Humanity, and it will be available on the Virtual Savannah Topic 1 location for you. So let me play that for you. This is part 1, and we have part 2, we talk about the syllabus, and part 3 we will have the actual discussion where I'm hoping you will respond with different online with the Virtual Savannah site.
I've gotta get out of here so I can save our family from this poverty. I'm gonna put my whole world in your hands. I had to put my
There's an urgent case. The patient is brought by Red Cross ambulance to one of the hospitals.
in your hands. Still I'm not allowed. And every time you promise me not much longer now, I've had to put my whole world in your hands. I'm gonna put my whole world in your hands.
This is Global Health Unit 1, and we're going to be discussing the syllabus and the different student requirements for this class. This is part 2 of 3 video clips for Unit 1. Again, we're trying to make this a very interactive and fun elective course. We're trying to encourage you to act as if you're photojournalists, working with the Solutions Journalism Network, developing innovative answers or solutions to global health challenges or problems. We use humanitarian quests that are part of a Facebook game called Half the Sky. Plus, during this class, you have a chance to practice your English. You'll be listening to my lectures in English, looking at the PowerPoints in English, and responding online with English. And I'm not worried about grammar. I'm not worried about spelling. So please don't hesitate to submit and participate with the class, because it is a global adventure that's supported by Virtual Savannah. So, Salud Global, the aim of our course is to develop practical skills, and that is through simulations, exercises, thinking about creative ways to solve problems. So, solutions to global health problems. Again, reducing poverty, maternal child health. What can be the next step? What would be one of the bottlenecks that prevents the programs that are working now to be more successful? I want you to be advocates for humanitarian assistance, helping vulnerable groups, helping improve family health. What kind of solutions do you have? One of the ways that I'll hope you will learn about global health is to look on the websites for We Want, the world we want. This is an excellent foundation that supports young adults and youth groups to improve their own communities by having creative ideas. The Right to Survive is an Oxfam International that's from London, England. They have a worldwide humanitarian aid, and it's in response to climate change, because there are so many more disasters, natural disasters, tornadoes, hurricanes, monsoons, floods. Again, it's all related to climate change. I hope that you can meet some of the global health challenges by completing 8 missions. So it's 8 different steps within a hierarchy, starting with the most basic, providing water, food, and shelter, and all the way up to level 8, where you're looking at action plan frameworks and planning something to do in one of the countries. Upstream Public Health is an NGO that's based right here in my hometown in Portland, Oregon. It has innovative solutions. They try to get communities to participate, but their main focus is on health equity. So they want people, irregardless of whether they have a lot rich or poor, whether they live in one part of town or another, to have equal access to health care. And it can be very challenging, so it's definitely upstream or up a waterfall. Half the Sky, it's a game for change. Again, it's based on Nicholas Kristof and Cheryl Woodan's book called Half the Sky. And these people are journalists. They work for New York Times. They've published this book and now have an interactive game, and it's to help raise awareness of vulnerable populations, but primarily women and girls. And we are going to be playing it online through Facebook, and if you don't currently have a Facebook account, or you want to make a new one just for this game, that's fine. You will be signing up and assigning a character name, which I hope that you will share with me, and you will be going through the stages of traveling around the world doing different things for global health. I've already downloaded the Getting Started guide, and again, it's available on the Virtual Savannah site. The Half the Sky movement for the game, you could see they have a user interface, have different tools that you'll be using as you interact with these different communities and learn about global health in the process. The global health missions will allow you to gain core competencies, and that's the name of the game, because this is a 4-credit course, even though it's elective. So you'll be looking at organizational frameworks, outreach and simulation activities. So there's a lot of things that we do during this course. After all, we have to be well prepared to meet the global health challenges. The Ebola virus outbreak was, at least 100 times bigger than any outbreak has been in the past. Very unusual circumstance, happening in Liberia and other, Sierra Leone, Ghana, different places in West Africa that had very weak healthcare systems, very weak health systems, no good public health surveillance. And so we suddenly were faced with inadequate protection even for our own healthcare providers. Again, we're going to be reading some chapters from our textbook, but I have downloaded the PDF files for you so you can have them online. There's no need to purchase the textbook, although it is available for download online. We're mainly going to be focusing for our course objectives on geography as it relates to health, so that why would somebody who lives in Australia, why should they have such better health and access to health services than, say, someone that lives in Zimbabwe? So that it's all based on geography, and we're going to be talking about your role as a public health practitioner if you're working in global health in an international location. I hope to cite cases about public health and human rights. Every unit we look at least 2 countries. Sometimes I'll compare Brazil and Venezuela, and we'll look at Colombia, of course, since you're more familiar with it, and how people work in international locations. We're going to be reviewing strategies for human rights and the right to health, so that we can look at the United Nations and the different documents there. I hope to broaden your worldview so that you understand that by caring for others, we actually make not only the world better, but we can also make our own communities better. We're richer because of our contribution to others. For example, we're doing Unit 1 today, is the Introduction to Global Health, but now Unit 2 we're going to be looking at human rights and global justice, the right to health, race disparities in health, and that Unit 4 we're going to also look at the Ebola outbreak in West Africa. Units 5 and 6 we're going to be looking at the basics. Again, food, water, shelter. These are the types of things that you might not think about. Here in Colombia, food security is a huge issue in parts of Sudan. Global health, we're going to be looking at refugee health and the UN Convention, public health ethics, and the fact that you need to offer humanitarian aid uniformly to anyone. You shouldn't separate different groups, such as someone that has HIV. Would you not offer help to them? That would be unethical. And Unit 9, we're going to look at health systems and how sometimes they're overwhelmed by so much need, and that Doctors Without Borders can come alongside temporarily and with volunteers to help. Because changing minds is the long-term benefit of saving lives. So you have humanitarian aid is short-term, and it's better to teach someone to fish than to just give them fish. So it's better for us as public health professionals to go in and do capacity building, training, education, doing different interventions to strengthen systems within a country for long-term benefits. Here's your student evaluation. I'm going to start talking very quickly so we won't run out of time. You can see that class participation counts 10%, but your group student country presentation is 40%. So you can understand that I'm hoping you'll spend quite a bit of time working on that project. We have written assignments that are part of the regular reading and answering questions, short answer Sometimes you have definition of terms, fairly straightforward short answers that will be submitted online, but please send them on time. I've had students in the past that turn things in late, and I'm just warning you that I deduct 20%, so if something is worth 10 and you've lost 20% of that, then you get a lower score for submitting your answers. Basically, I try to keep you well informed about what is due and when. In February, we'll be checking your progress with Half the Sky on Facebook. In March, I'll give you a midterm tally of your points. We have some ways to make extra points, like watching the video for the Rwanda segment in Unit 4. You can give me a summary of that, so that would give you extra points. Before we go to Easter, I want you to have selected your student group, your country, and your topic. So that would be like choosing Zimbabwe and doing poverty reduction, or choosing South Africa and HIV prevention, malaria prevention in Myanmar. So these are the types of things that I would like you to be considering for a project, and there is no final exam. Your presentation is a way of showing that you have learned a lot in our class. So again, contribute to the classroom debates online. We have the Jeopardy games and matching. Your upstream global health challenges, again, it goes from the most basic all the way to climate change, and the 8th one has to do with developing an action plan. The Jeopardy game, again, here's an example. From view from above, is this France or is this Mexico? Again, it's just a matter of becoming more familiar with your global environment, and it definitely can be more challenging as you go upstream, and so this is why I am showing the pebbles from the most basic example up to the harder challenges. As you can see, our salmon here trying to go upstream. Since I am in Portland, Oregon, we always think about our salmon going upstream in the fall, and they going up and up and up, and then they encounter a waterfall. This is a big challenge. Debate, again, trivia. We've got our pink and yellow Kirby's to have competitions. Reading assignments, you'll have your chapters for each unit. Most units have a few pages from a chapter. We have online humanitarian videos that are part of the interactive learning, and then glossary, as I mentioned. After all, you need to be well prepared to meet some of the global health challenges in our world. And again, these people that were risking their lives and going in to help people with Ebola are remarkably, they should be commended. It's such a difficult challenge that they faced. And you're going to be among them, facing those challenges. So let's look at these country projects. Again, student groups of 2 or 3 students. I don't like to have more than 3 in a group. You can work alone, however, and you choose one global health priority problem and come up with a solution for one developing country. So you can choose any country except Colombia. You'll be presenting your project no later than May 15th. So again, we'll be doing the projects in English. These are the step-by-step country projects. Again, I will make these available through the syllabus online. You have a PDF file. You can read through this information so that it's a backup to this video. You select your country, your topic. You prepare a project, so a presentation that summarizes your findings. It should be about 30 slides or 20 to 30 minutes of a video. And I want you to have some bibliography. Again, resources. I have an online reference list that I'd like you to use, because you can't just Google information, and Wikipedia is not considered a reference, so please don't cite Wikipedia. Here are the steps again. I want you to have an introduction with your Millennium Goals, which has to do with the World Health Organization. 4 examples of a successful